Hi, good evening. Welcome everybody. Our agenda for this workshop is a brief introduction of the purpose of the workshop, followed by a step-by-step description of the process for obtaining these local governmental unit resolutions. And that's going to be presented by Don Pilkinen. And then Linda Gridley is going to talk about a successful resolution process in the city of St. Paul that actually happened last summer. And then we will hear from several Healthcare for All Minnesota members and activists who are working on resolutions in their local areas. Steve Janis from Northfield, Jerry Whitty from Duluth, Mark Friedman from Mankato, Carla Sand in Maplewood, Hillary Bessie and Judy Floor in St. Louis Park, and Dave Garibaldi in Osseo. We, of course, hope to inspire others to take this on. If there are any efforts in local areas that we don't know about, feel free to add your experiences so far during the Q&A, which comes later on in the event. We plan to have about 10 minutes for an open discussion and questions and answers a little later on. We'll also talk a little bit about some plans for follow-up for this evening's workshop, including information, tips and tools, some sample resolutions, regular meetings and check-ins with people working on city council resolutions initiatives in their local area. And we will finish from some announcements and a wrap up from our host. I will also end with a call to action for a specific legislative issue. And this program is offered by the Healthcare for All Minnesota and Physicians for a National Health Program Minnesota Education and Outreach Committee. I want to thank Jen Crawford, Executive Director for PNHP Minnesota, for hosting our event this evening. Okay, so what is our evidence that the cost of healthcare is of concern to local governments? Well, consider these two comments from leaders in two different cities in Minnesota. From the Duluth News Tribune in September 2019, the Chief Administrative Officer for the City of Duluth shares his concern that healthcare costs for city employees could increase by more than 1.1 million in the coming year. That this rate of increase in cost is unsustainable and could, in 10 years or so, increase to the point where this one budget item could consume their entire general fund. He further states that they would need to bring this to the bargaining units representing city employees. And then from an article in a news publication in the town of Northfield, the president and CEO of the Northfield Hospital talks about his concern that so much more of the cost of healthcare over the last 5 years has been shifted to patients and their families because of high deductible insurance plans and the out-of-pocket costs, which are especially difficult for families with lower income. In this same article, he notes that high costs and inability to pay can end up destabilizing hospitals, and I will add especially rural hospitals, if the amount of uncompensated care goes up beyond their ability to absorb those losses. These are only two examples. Don is going to talk about how these kinds of concerns led to the program we are presenting this evening. So I'm going to introduce Don Pilkinen, who is our board member and secretary treasurer of Healthcare for All Minnesota and liaison to our legislative committee to present our content for this evening. Go ahead, Don.
Thanks very much, Ann. And thanks for using those two examples which show that or exemplify that there are solid community organizing reasons for using local resolutions to advance single-payer universal healthcare legislation. Because cities are struggling with the cost of employee health insurance, which is taking funds from other services, and because employees and residents are paying higher out-of-pocket costs, these kinds of problems should motivate our city councils to be a voice for the Minnesota Health Plan and Medicare for All Act by endorsing resolutions for these bills. Furthermore, their endorsement will make news in the legislators' hometowns, which will strongly influence them to support the bills. City councils are especially needed now to hear and endorse the resolution because a divided state legislature has shut off committee hearings on the Minnesota Health Plan during this biennium. Therefore, rather than waiting for the next legislative biennium in 2023 for committee hearings on the health plan bill, constituents can work now with their city council members for the endorsements and bring them to their legislators at town hall and scheduled meetings. Furthermore, the endorsement calls for city council members and other city officials to encourage, that is, lobby their state legislators and U.S. representatives to sign on to the bill. So this adds to the grassroots support. Chances are good that your city council members will see the sense of the resolution. If the city budget is struggling with the cost of employees' health insurance, and if they see that many of their residents are uninsured, underinsured, and forced into high deductible plans, which are becoming junk insurance. We're not alone. Our city resolution campaign in Minnesota is part of a national Medicare for All campaign provided by National Nurses United, Public Citizen, and other organizations, which have won city council endorsements from Los Angeles, San Francisco, Seattle, New Orleans, Philadelphia, Ann Arbor, Detroit, and right here in St. Paul, Minnesota, which will be reviewed later by Linda Gridley. Let's now look at the step-by-step process that the advocates with us tonight are using to bring before the resolution before their respective city councils. First of all, find others interested in working with you on this project because you will need a team and a game plan. Review your local government budget specifically for employee health insurance costs and other demographics on uninsured and underinsured to localize your resolution. Know the process and requirements for obtaining budget information directly from your local government. Understand the number of uninsured and underinsured residents in your city and county. Draft your resolution with solid reasons for asking for the endorsement. Find city council members to sponsor and support the resolution. Work with the sponsor to get the resolution on the council meeting agenda. Find 2 or 3 testifiers to highlight local healthcare and coverage issues. And finally, attend the council meeting with supporters where possible and communicate success. Before reviewing these steps, I want to acknowledge that Minnesota COACT and HCAM partner didn't plan very well 10 years ago when I, as COACT's executive director, offered a resolution to the Pierce City Council in central Minnesota to support the Minnesota Health Plan. I offer the resolution because I learned from the local newspaper and meeting with the city administrator that the city of Pierce stopped its health insurance for her, the city administrator, and 4 other city employees due to high costs, and that the mayor and city council might be supportive of the Minnesota Health Plan. Therefore, she, the administrator, and a supportive council member got me on the agenda to offer the resolution. Although I had local and county COACT members with me when I presented the resolution, the supportive council member should have offered it instead of myself, which may have been one reason the council tabled it. So the overall mistake was initiating the resolution on my own without a local team with a game plan. So the first step for you to consider is to find others interested in working with you on this project. Because your friends and neighbors expect city council members to do a good job, on snow removal, potholes, fire protection, emergency medical services, and other services, there may be some residents that you know who also expect the council members to care about the rising costs of health coverage for city workers and residents and the number of uninsured and underinsured. To show why council members should encourage the resolution, get the city's budget for its employee health insurance costs and get local demographics on the number of uninsured and underinsured residents by Googling your city budget, the Minnesota Department of Health, the Census Bureau. Also, this might be a subject for the plight of the city budget, and local residents might be the subject of local news. For the cities of Duluth, Northfield, Mankato, and St. Paul, I simply Googled keywords such as city budget, city employee health insurance costs, and number of uninsured residents. And I came up with information and sources for each of these cities. In other cities, such as Maplewood, you may not be able to get the employee health insurance costs by simply Googling online, and will have to go directly to city administrative officials, as Carla Sand did. Carla contacted city staff, who instructed her to submit what's called a Maplewood data request form to get information, which she used to request the following. Number one, the city employees' health insurance costs in the city's budget, and increased costs to the city if they indeed exist. Number two, the health insurance costs as part of the city's long-term debt for employee benefits, if they indeed comprise that debt as reported in their comprehensive annual report of 2019. In response, a citizen services specialist speaking for the city's finance director said the employee's health insurance cost for 2021 is $1,010,000. But she didn't say, the finance director didn't say, if those costs are becoming a burden on the city budget. In other words, that $1,010,000 is just standing alone right now. And we need more information on that. So Carla did meet with her supportive city council member, who said that she will sponsor the resolution. So maybe the council member can help gather more information from the city's finance director. Along with getting this kind of information, understand the healthcare problems of the residents of your city and county. For example, in rural Minnesota, health coverage is a top concern for family farmers and Main Street business owners, because the individual health plans they depend on have annual premiums and deductibles of $25,000 to $45,000, according to Minnesota Farmers Union. This is more than the median annual incomes of family, crop, and livestock farmers, according to the Star Tribune. Unaffordable coverage in rural Minnesota is caused by the state's small, more expensive market of individual plans due to an unusually large number of sick people in these plans, according to the Kaiser Family Foundation. And it's these individual plans that farmers and Main Street business owners depend on, because they don't, get employee company coverage. Regardless of the rural need, Blue Cross and Blue Shield, which has an expensive customer pool, pulled out of the individual market, which sent their customers to other insurance companies, which in turn drove up the costs of those plans. Likewise, small business owners in the Twin Cities received little or no help in the pandemic from their insurance companies, who refused to defer premium payments until their businesses could recover. According to City Page's news reporting, they were unable to discuss this deferment with Blue Cross Blue Shield, United Healthcare, Health Partners, and Medica, which are the big sellers of small group plans. Although small business owners worked well with vendors, suppliers, and utilities on payment deferrals, the small group plans were difficult to work with and denied deferments. After getting compelling information such as this and understanding your local problems, you are ready to draft a resolution with valid reasons to justify asking for the endorsement. Begin by localizing the rationale with a few whereas clauses that may include budget breaking, health insurance costs, and number of uninsured to justify asking for endorsements at the end of the whereases. For number one, the Minnesota Health Plan and Medicare for All Act, and the second endorsement for city council members and other officials to encourage, that is, lobby their legislators to support the bills. By now, upon drafting the resolution, you may have thought of or been in touch with city council members who might either sponsor or support it. At this point, Carla Sand of Maplewood, Jerry Witt of Duluth, Dave Garibaldi of Osseo, and Linda Gridley of St. Paul would like to share their experiences on how they went about contacting and meeting with city council members in their respective cities. Some were able to leverage personal connections they've made by working on the electoral campaigns of some of the city council members through door knocking, phone calling, and showing up at town hall meetings and forums. At our prep meeting last week, Jerry Witt made a very important point on the need for the sponsor to have a fellow council member as well to second the resolution at the council meeting so that the sponsor isn't just hanging there. Okay. In addition to getting a sponsor to offer the resolution, it will need 2 or 3 credible.
Don, you were going to ask each of these 4 people to make some comments.
Yeah, I'm getting kind of ahead of myself here.
Yeah, you're on your script.
I'm on a roll.
So let's call up our presenters. How about that?
Okay.
Great.
Did you call on me?
Yeah.
This is,
yes. Carla.
Well, yes, I live in the city of Maplewood, and I worked with Nikki V on the Disability Caucus and got to know her stand on healthcare. And then she ran for the city council, and I worked on her first campaign, which turned into a tie and an interesting campaign. But then I worked on her second campaign, and she did win. And now she has agreed to work with us on possibly submitting a resolution to the city of Maplewood City Council. So that's where I am now.
That's terrific. Thank you.
Mm-hmm.
So Jerry, I hear that it's been pretty busy with you up in Duluth on this project.
Well, back in mid-February.
Oh, Jerry, you're muted somehow. I'll unmute you. Okay, go ahead.
In mid-February, Don sent me the city council resolution that they were trying to get passed. And I went to I was looking for my second first. And my city councilor who I've worked on his campaigns should have been on board. He didn't return my phone calls or emails, so I went to a second source, which was a campaign manager of Roz Randolph. And she had some issues with healthcare and health insurance, and her campaign manager said she'd be all over this, and she was. So later, my city council member called me back, and he had some personal issues. He was on board and would be a second for it, but he couldn't work on it. He did recommend then Roz Randolph also And I went to my third choice for a second who could be helping Roz, Joel Cypress, who I knew was going to be on board. He would have been my first, but I wanted to get enough people working on this. And once I had my people lined up, I cleaned up the resolutions and made them fit for Duluth. And I sent it to a local expert, Buddy Robinson, and had him review the facts to make sure everything was kosher. And he made some stronger language in the resolution, but nothing in the whereas. Everything in the whereases were great. And I sent him off to Roz Randolph, and she jumped all over it, and she went and said, I'm going to contact our state senator, Jen McEwen. And they did, and they're working on it. And after the meeting, I had a call to get a follow-up. And I sent a text to Joel Cypress, and he responded. Roz and I met with John Marty and Jen McEwen recently. Based on that conversation, we are aiming at September to introduce the resolution. Okay. John and Jen thought we might be able to continue with an informational legislative town hall type sessions in Minnesota Health Plan. We were also talking about reaching out to other cities in the area to get their city councils to come on board also. So it's moving.
That is tremendous. And as I'm going to mention later, well, maybe I can wait till later, but that's really good news. Dave, how about what's happening down in Osseo?
Remember, we'll have time to share more about the actual process a little bit later. This is just about how did you choose your sponsor?
Yeah.
Okay. Yeah, Osseo is a very small town in the northwest corner of the Twin Cities. It's an older town that got kind of surrounded by the sprawl of the suburbs, of the outer ring suburbs. And so it's only got 2,000 people. But I'm acquainted with one of the city council members, and while she was running for her campaign, and I didn't actually participate in it, but my wife and I got to know her pretty well. She was very progressive, and she was also in a group called Housing for All, which we joined and got to know her better and other people in that group. So we made those connections there, and then that was a couple of years back, probably 3 years ago. And then last year, there was another person that we were acquainted with, and she was on the council also. So we threw her our support behind her, and she did win also. So I've got those two that I know quite well now, and am planning to exploit that and hopefully get them to introduce this for me. And a third council member, now there's only 5 on the council, including the mayor. So all I need is a third, and he happens to be my next door neighbor. And he's a little more conservative and a little more skeptical. He's an older guy. And, but he is open, and I'm having discussions with him right now. And so that's where I'm at.
Great.
Yeah, you folks have been very busy. Linda, how about just sharing again the experience you had with the council member who you and Rose worked with to be the sponsor?
Yeah, so excuse me, I actually had like a political friendship relationship with 2 women on our St. Paul Council, my own council member and another woman by the name of Nelsie Yang. And I had actually phone banked for both of them. and had worked on a project with Nelsie. And I also knew that Nelsie had attended, as I believe Mitra had, they had attended some of the strikes that the nurses, they had walked the line with the nurses. And another thing that happened was both of them, we had a St. Paul school board member whose father was one of the frontline workers. He came down with COVID. He passed it on to the school board member, and she did pass away. And she was friends with both Nelsie and Mitra. And one day when I was kind of frustrated because I had been working on this petition for Betty, I picked up my phone and picked Nelsie to text. And she was really excited about doing it. She absolutely wanted to do it. I knew that Mitra would back her up. I knew Jane Prince would. And so Nelsie pretty much then ran with it. And she set up she got it on the agenda. And I think it took a month. I had sent her Don's version of the agenda, and they pretty much used that. I know they changed it a little bit, so it was their wording. But it passed unanimously. There was one member that did not show up that day.
Yeah, thanks. Thanks you all. These examples show how you folks are really getting use out of your council members, because after all, they are public servants. And this need for their endorsing the Minnesota Health Plan and Medicare for All Act is certainly a humongous public need for them to do public service for. So thank you for your great work. So I'll proceed with the next step after we've heard more about how to go about getting a sponsor and support from the council members. So in addition to that, you'll also need to get 2 or 3 credible testifiers, residents, to testify on the need for the Minnesota Health Plan and Medicare for All Act. So it's important that they know how these bills will help them. They may need these testifiers, could be a small business owner struggling with employee health insurance, or an ER nurse seeing patients who delay getting necessary medical care due to lack of coverage, or an unemployed parent who lost family coverage along with a job. The job of the sponsor is to get the resolution on the agenda of an upcoming city council meeting. So stay in touch with your sponsor and supporters in case they need supporting information relating to what's cited on the resolution, or if they need help with talking points or assurance that the whereas clauses do indeed relate to the city's concerns, and assure them that you and your team are standing by to help with resources and contacts, such as Senator John Marty, who Jerry had just mentioned. After all, he is chief author of the Minnesota Health Plan, and would like to talk with council members on his bill. And what about health policy analyst Kip Sullivan, who will be doing tutorials for legislators and would like to include council members as well. So now the time has come to attend the council meeting where it's possible and communicate success. Find out the process, first of all, for residents to attend council meetings, which may still be virtual. And so you're going to have to call city council staff or go to the council's website to get to know about the process of attending in these strange times. For turnout, HCAM's listserv may be able to send notices to the city residents. Next, communicate the council's endorsements.
So Don, let me just throw in a piece that we did talk about presenting. There, the person working on this may have to learn how the resolution will be discussed in their by their city council and how it will get on the agenda. So there may be a process in there of working with your sponsor on actually getting it on the agenda. Correct. Right. And then who can attend the meeting and support. Also, please consider providing written materials. Okay. And how can you best educate those council members? Okay, sorry to break in.
Oh, that's fine. Thanks for necessary information.
Yep.
Next is to communicate the council's endorsements with a press release and send information to HCAM and PNHP Minnesota. HCAM should publicize the city's endorsement on its social media, along with the council's announcement and local news reporting. And you may also want to call your local media about it. Allied organizations such as M&A might also want to publicize it on their social media. And of course, use the news of the endorsement to help influence the area's legislators and policymakers. I think now we're ready to hear more from Linda to explain the process and success of the City Council's endorsement.
So I have to say, through much of this, I had a lot of support from Nelsie, Rose Roach, Don, and Ann. Everybody jumped in as soon as Nelsie said she would do this. So I claim very little credit for the overall process of what happened, but Rose had she had been talking to Nelsie about doing this. And so when Nelsie agreed to do it, Rose was one of the first people I contacted, and she came up with a small business owner and a nurse to speak on behalf of the need for Medicare for All. And Don already had the resolution, so I was lucky no one had to write up anything. And I had, I belong to Twin Cities DSA, so I knew there were people in DSA that would back us up, and some other people both in and outside of Healthcare for All Minnesota. So I would say between Ann and Rose and Don, it all came together, and it was just, it happened really quickly. We were super lucky, but it was just a bunch of circumstances that all happened at the same time. And then as soon as it passed, Nelsie sent me a note, and she said she was going to make sure it was published in places that Betty would see. So, and there was one other thing, there wasn't an added piece to it that Tim Johnson from Twin Cities DSA added, and it had to do with money for COVID. Do you remember the exact wording of that, either Ann or Don? I just at the moment I can't think of it, but it was to help with COVID related issues.
I don't think I have a copy of that addendum. I have a copy of the original. And I just wanted to point out something that was on one of our previous slides, that we did make sure we had with the St. Paul City Council process. We asked in the be it resolved that the members of the council would actively support this proposal and this Minnesota Health Plan and Medicare for All at the legislature as soon as we get hearings at the legislature, and that they actively support with members of Congress. So we are recommending that be a standard part of resolutions going forward. So
and the only one we don't have a clue on is the one that didn't show up that day. And it's not clear why she didn't show up. I mean, I don't know if it was personal or what happened, but the others all agreed to participate later. And in spreading the word, like I said, Nelsie made sure it got published in places that she thought Betty McCollum would see it.
Yeah, I do recall something putting in one of the whereas clauses on the COVID issue and the hardship that's created for local business owners and such. I think that I don't have the resolution in front of me, but I had just mentioned that City Pages really did a good job on how difficult it was for the businesses during that time. So yeah, it really pulled together well for you, Linda, and you did a great job of delegating work to a lot of the players that pulled it all together.
Well, everybody was so willing. It was super. I mean, it wasn't like it was pulling teeth.
Yeah, and that's what it's supposed to be. It's supposed to be positive and enjoyable.
Right.
And knowing the purpose of it, that all this results in getting the endorsement for what we all need these days, which is total healthcare reform. So I don't know if the word ideal applies here, but I think it probably comes as close to it turning out very, very well. And so the experiences of the other folks with us tonight, they're at different stages for various reasons. And that might be more of the norm, although Jerry Witt up in Duluth seems to really be pulling actors together as well up there. And then Carla, she's got a great sponsor. And I don't know, it just seems like it's rolling along elsewhere too. So let's hear how it's coming along. Steve, can you start with how it's going down in Northfield?
Sure, Don. Down in Northfield, we've had an ongoing process. I think it's well over a year now. It's hit some rough spots to the extent that the city council and the mayor have kind of looked to the Northfield Hospital for their input, and the executive director there, and he's been somewhat hesitant to get on board with this. We're continuing to meet with him and talk about it. Kip Sullivan has been helping meet with him to talk about a Medicare for All type solution, and how it would help the hospitals be able to survive and thrive, especially in more rural communities. Northfield is kind of unique in having a locally owned hospital, and it sort of sits between real rural small community hospitals and the larger complex hospitals up in the cities or potentially even in Duluth. And we have a fairly progressive community, but there's a lot of different groups that are working on energy, gun control, immigration and such. So we're having to really pull them in as part of that. So it's sort of right now, we're still in an ongoing process.
Yeah, thanks, Steve. And Jerry, is there anything more that you want to add from your earlier report
Well,
up in Duluth?
I would like, everything you said is kind of what I did, and it does work. And city councils are all a little bit different. My next phase, and I think we should do it, you shouldn't go wait for the vote on the resolution at the city council. Before that happens, your city councilors talk to each other. So who's going to sponsor you and second this and move this through? You should find out what councilors are going to be pushing back, and get people that you're connected with in their district to phone call and put some pressure on before they have to hear the stories in front of the city council to pass a resolution. So put up a little pressure campaign, and it doesn't have to be everybody. Like I said, your councilors talk to everybody. They kind of know what's going to happen. They don't want to get caught with their pants down either. So they can make a recommendation, and then you can come up with people in that area, and they can make phone calls and push it a little bit harder.
Yeah, I think that we're used to operating at the state level, and we've done action alerts. I know I've helped get out action alerts for folks to call their state legislators on these measures, but now we're shifting to the city level. But it's the same thing that has to happen. What you just described, to get the calls to the council members. So thanks. Yeah, Mark, how's it going in Mankato? I hear that you folks down there are a pretty busy crew.
Well, we try to be. As far as resolutions go, in particular, we've kind of left it alone for most of the COVID time, and we're revisiting now. I think from our experience, a bit more than a year ago, when we were acting on fairly intensively, is just the importance of persistence. I think we experienced what some of the other people are reporting, that council members are not the best at returning emails and returning phone calls. So you just have to keep at it. We're actually working on 3 cities now, Le Sueur and North Mankato, as well as Mankato. And we're getting some of that with each city. So for example, when I tried to contact the chief financial administrator in Mankato, it was the early days of COVID, and honestly, they were in chaos. So there really was no bad faith, but it just took a long time for him to get back to me. And once he did, he was very helpful and gave me the data that we asked for. City council members have been, some have been vaguely supportive, but nobody's really made a commitment yet. So now that we're reviving what we're doing, I think we're going to try to nail somebody down. So that's going to be our next step. One council member told us to just show up at a meeting where they have kind of an open forum and present, but we really don't want to do that, as other people have advised, until we do have a sponsor lined up.
Yeah, and I did recall your sharing, your localizing the resolution in behalf of Mankato's interests.
Oh, very much so, sure.
Yeah. Hillary and Judith in St. Louis Park, I hear that you folks are interested in getting started. So is this reporting from the others in their respective cities, is this encouraging to you, for you to keep going to advance from your interest to get started to actually look at meeting with a possible sponsor?
Yes, actually, This is Hillary, and Judith and I have been texting about what a good meeting this is and how much information we're getting about the process. We have a council member identified that we believe is going to be open to the idea. And she was just appointed last year, and we both know her from working with the DFL locally. And so, but has her official election this fall. So right now she's campaigning for that. And so we'll be helping her with her campaign. Right. And so I think we'll probably wait until after that election to, when she's really established. I'm not sure. We'll probably broach it with her, but before we take action, we'll have to wait for her to be set again, I think. But we also have a real definite second person that we have met through the DFL, but don't know as well. So we think he will be a supporter. And we're hoping that the whole council will be open, but we really like the process you're setting up for us so that we know the steps to take. So we really have appreciated that. So thank you.
Yeah, you're welcome. And it sounds like you're really working with leveraging the council members by doing the electoral work for those folks. So yeah. It's a give and take. Again, they're your public servants. You've worked for them, and now it's for them to come across in supporting this crucial endorsement. So, Dave, again, down in Osseo, is there more that you'd like to relate from what you said earlier? You mentioned that you have met, that there are 5 council members. That in fact, there's that third one next door. So it sounds like there's a lot of potential there.
Yeah, I'm pretty optimistic at this point. And like I said, I'm going to be working on that third one. And also, I'm right at that point that Carla mentioned about getting the information from the city staff. And I've been working with the administrator who hasn't been really forthcoming with the numbers I want. And, but I've kept pressing the last three weeks or so, and I'm starting to get some headway now and expecting some numbers soon. Unfortunately, Osseo does not have that information online. I did try and get it, and they've been in flux for a few years with personnel and on their city staff, so they're kind of behind on some of those kinds of things. But one thing I did think of today, and actually relayed to the city administrator, is dental insurance should be thrown into this mix. The cost of dental insurance will be done away with also, because dental will be covered under both the Minnesota Health Plan and Medicare for All. Mm-hmm. So that's a thought you might want to, when you're asking for this information, to get. And the only other thing I wanted to mention is I've only lived in Osseo for just shy of 4 years, so you can get to know people pretty fast. Of course, it's a small town, but what I've also done is started putting my tentacles out to some of the other suburbs, and I got to know a couple people that were running for county commissioner. So right now I'm familiar with several, and 2 did not get on county commissioner, Hennepin County Commissioner, but 1 did. And I know him very well from the Senate District DFL. And so you can always start looking at some of these other cities that are nearby and start making connections. And DFL is one good way to do it, but there's just other progressive groups where you get to know, and pretty soon you start, especially if you can like give yourself and get your name out there. It can't hurt. And so those are a couple other suggestions that I have.
Your networking is based on what you really believe in. It's the the strength of the goal of getting the Minnesota Health Plan and Medicare for All that keeps us going. And I don't know if I should use the word selling, but that's what we're doing. We're selling a way to fix our healthcare mess. And you guys are really doing a great job in promoting that with responsible public servants.
So I'll step in for just a minute and say we planned about 10 minutes for questions and answers from all of the attendees for this evening, and then for presenters amongst each other. So Jen is going to help us look for raised hands on the screen, and anybody who's attending this evening is welcome to ask a question of those people in the trenches who are already working on this. Do we have any questions?
It looks like we do have a question from Mary. It's in the chat. It says, what specifically is the ask since there is no Medicare available on the state or federal level?
The ask, let's see.
Well,
I could back up all the way.
Why don't you show that up again? Yeah.
Let me back up all the way.
Yeah, I think you just passed.
Be it resolved that the city of St. Paul affirms healthcare as a basic human need, which should be guaranteed to all Minnesota and U.S. residents, endorses the Minneapolis Health Plan and Medicare for All. It's really that simple. And then it's be it further resolved that the city of St. Paul will, as we talked about earlier, help us press our case for the legislature or the Congress when those bills come up for consideration. Those are the asks.
Yeah, I think it's really neat. What's happening is that citizens like who we heard from earlier, they're really forming, creating a team relationship, teamwork with the city council members on this.
Hopefully that answered the question.
Great, thank you so much. It looks like our next raised hand is Dr. John Crossan.
Oh, thank you, Jen. I wanted to ask a rather broad question, and the question is basically, once city councils endorse Medicare for All, both the Minnesota Health Plan and the 1976 plan in the U.S. House, what influence is that supposed to have? Are we trying to influence local legislators? Are we trying to influence people who live in these cities? And what direction does this go once the city council endorsement is made?
Well, it's I think it's going to be very effective in getting the legislators to think more seriously about supporting the Minnesota Health Plan and Medicare for All, because after all, the city, who's closest as an elected official to the people? It's the city council members and the county commissioners. And it would be foolhardy for legislators to not heed what the more grassroots representatives are telling them. on the cities and the counties' plight with our horrible healthcare system.
So it's primarily then to have some influence on legislators both in the state and nationally.
Yes.
Okay,
Yes.
good.
Great. And if anyone else has a question for our panel, our experienced folks, feel free to use your raise hand function that's found at the bottom of your screen under reactions, or you can feel free to unmute yourself as well, and we're happy to answer your questions.
I have something that I would like to add in the case of getting the resolution passed in St. Paul. I met Nelsie when we were working on Restore the Vote for felons coming out of prison and even in prison. And we were at a meeting with Noel, no, I can't think of his last name. I just had it. Anyway, he was, or he is Melvin Carter's, one of Melvin Carter's aides in the mayor's office. And he overheard myself and another women's march. We were talking about Medicare for All. And he said, boy, he said, you know, the city of St. Paul, we spend so much money and we're really trying to figure out how we're going to deal with providing insurance for our city employees. And so I gave him my card and I did contact him. I never heard back from him, but he had already stated that the city was in trouble. And so I was able to get the information just online of approximately how much the city of St. Paul did spend on insuring their employees. And so that was another thing that I did talk about with Nelsie. I mean, she was very much aware of it, but it was another talking point in using it to get other members of the council on board with it too. Although we had a pretty agreeable bunch, I have to say.
Yeah, Linda, what you just said relates to a question that just popped up. How do we talk to conservative council members about the Minnesota Health Plan? Well, to begin with, the rising costs of city employee coverage is just possibly taken away from other city services. So that should be a serious concern. And this would be kind of quelled by the Minnesota Health Plan and or Medicare for All. Because of the cost savings to everybody, government, business, families. So I can't think of any conservative who would not want to have a healthcare system that saves money rather than wastes money. After all, conservatives are supposed to be fiscal conservatives.
Perhaps I could add one thing. My experience in talking with conservative legislators and council people is they pretty consistently bring up unfounded myths about single payer. Particularly, they'll bring up how awful Canada's system is. So if you can be prepared to kind of refute those things, no, a lot of those things about Canada are groundless or exaggerated. Medicare for All will not be prohibitively expensive. It'll save us money, etc. So,
yeah, if we could just get them to sit still for long enough to hear the facts, from the likes of, some of us who are knowledgeable or Kip Sullivan. I think that some people, some politicians prefer to bypass the facts and just go on with their pretense of a system. They think they say that is working, but I wonder if you could really believe what they say about, you know, the system working better than what we're proposing.
I see Dave and then Jerry with raised hands. Dave.
Yes, I wanted to add on to John Crossan's question. Yeah, I agree. One of the reasons I got into this was of course, I've been lobbying Representative Dean Phillips of MN03 to get on board with Medicare for All. And one angle that I thought of was to just start picking off city by city and gaining momentum within his congressional district, all these cities, and maybe get other people on board as I move down to the south, cities that I'm not as familiar with, but maybe other people are. And but one thing I got to thinking about also, there's a side benefit here because you're going to get press releases, you're going to get publicity, it's going to lend legitimacy to these both state and national proposals. If you get, you know, a bunch of cities suddenly signing on, people have got to start paying attention. And right now, that's our biggest problem, is we've just got too many people that aren't paying attention. So I thought I'd add that in there. Thanks.
Okay, then thanks, Dave. Jerry, are you?
Well, it's more of a comment
Okay.
after I get
Okay.
the city council to pass this in Duluth. I fully intend to take my experience to the St. Louis County level through the county board. So
Great.
we could do this again. The county needs to save money also.
Right.
You know, another, if it grows enough, it should be of interest to the Minnesota Council of Cities and the Minnesota Council of Counties.
Mm-hmm.
If it could grow to that degree.
So thank you, Jen. Do you see any more questions? And we're almost at 10 minutes.
Yes, I think you hit on a few things Jerry just mentioned, that you can take this tactic toward other government bodies, so county boards. Do we have any of those plans in the works right now?
Well, Dave mentioned the Hennepin County, which triggered me to realize I should be working with Dave on Hennepin County. I believe Hennepin County is responsible for the cost of Hennepin County Medical Center, so that's a big one. So yeah, we probably not concrete, but we will need to move in that direction. Thanks, Jen. I think we're at 10 minutes. If nobody else has more questions, we'll proceed with the workshop. Don?
Yeah, I again want to thank everybody for their the good work that they're doing and sharing with us this evening. These examples show that this is a work in progress, which may, and I think of course will need mutual follow-up support. So wherever you're at, we're doing good community organizing. So now that we're all together tonight to look at how the city council endorsements can be obtained and are being used as a strong voice for the Minnesota Health Plan and Medicare for All, especially now that there's no committee hearings on the Minnesota Health Plan. The question is, how do we move forward? So there are some considerations that Ann and I kind of pondered, and I believe they're up on the screen. Discuss ideas and experiences for the kind of support we may need, share information and tools. Should there be a monthly check-in? Should we do more workshops? how do we stay in touch with the council members we've started working with? How do we bring in more people in other cities who may be interested? So I don't know if we really have much time to discuss this, but what of those items listed that you think we should be working on?
Does that sound like we're headed in the right direction? I guess is what we thought. We would get some feedback and then we'll finish up. Oh, Judith?
I would certainly like to see the monthly check-ins because it kind of helps us to keep on track. And right now I think that's valuable for all of us. So I would at least like to see monthly check-ins, if not more.
Would these be check-ins for the individual areas of Minnesota that people are working on, or would this be a check-in for all different parts of the state to check in together?
You know, just preliminarily, I think our vision was just having everybody who we know of who are working on this, and of course, invite anyone. We could send notices out to say if anybody's working in their local area and we haven't heard about you yet, please join us. You know, well, I think we'll start informally, but see how useful that kind of structure is. We just think we probably need a little bit of structure to this effort, not leave everybody on their own to their own devices without some help. Although progress has been pretty impressive. So
yeah.
Okay. All right. So go ahead.
All right.
Let's see. I've got some comments for this one, Don, if that's okay.
Yeah.
I'll just say that Don mentioned that it might be necessary to educate both the council members you're working with and the testifiers on some health policy basics, including how to respond to frequently asked questions. And as Mark already noted, how to respond to frequently raised objections. They are actually pretty predictable. The best way to do that, in my view, is to be firmly grounded in the problems with cost, quality, and access to healthcare under our current wasteful, inefficient, inequitable, and extremely expensive multi-payer system. And also to be well informed on proposals for change. Because knowledge is power, I'll just highlight some of the resources that we have available to help you, not only with City Council resolution initiatives, but also just in talking about healthcare reform with friends, family, neighbors, coworkers, and voters. Starting with Senator Marty's book, Healing Healthcare, which is the go-to reference for the Minnesota Health Plan proposal. And then Physicians for a National Health Plan is an excellent resource, especially in making the economic case for change, and especially at the federal level. I always really suggest fixithealthcare.com. That's right on your computer. You can go there for excellent videos that if you're not comfortable talking about this yourself, say, hey, do you have 10 minutes? Let's look at this. There's several longer videos and several short videos on different subjects, including busting that myth about the Canadian healthcare system. So fixithealthcare.com is an excellent resource, especially making the business case for reform. But and again, for those videos that explain basic concepts and solutions. And of course, I will call your attention to our website, which is www.hca-mn.org, which is a good resource for basic information, as well as a toolkit under the resources tab with lots of great information for you to use and share and print and have in your hand. This slide is just a bullet point set of the key issues under our current healthcare financing system. Our job as honest brokers for fixing how we pay for healthcare is to be able to explain what's wrong, why incremental measures have not worked, and why we need definitive structural change. I always find it helpful to have materials ready that I can use to explain and educate. So you can have something you can talk about and show somebody at the same time. So all of this stuff is available for you to print as handouts or talking points like little cheat sheets. So I just suggest printing this along with the next couple of slides to have available in handling questions and presenting information. This one is a summary of the key provisions of the Minnesota Health Plan. Not a substitute for reading the book, of course, but this is our state-based single-payer proposal. Senator Marty's book, it's 140 pages. It's riveting. You have to get it and read it. It's available either online with an electronic link, or we can get you a physical copy. So it's an invaluable resource in understanding the proposed legislation here in Minnesota, including the policy behind it, so the why, including the actual proposal and a responsible transition plan. And of course, the most comprehensive bill at the federal level is the Medicare for All Act of 2021, newly reintroduced. It's HR 1976. I strongly encourage everyone to read this bill. You may groan and say, oh my God, read a piece of legislation. It is actually really interesting reading. This is the cheat sheet for what's in the bill, but please read it and you'll really feel like you know what you're talking about. So I really strongly encourage it. You can get that bill at congress.gov, HR 1976. We look forward to a Senate companion bill in the fall that we hope will line up a little more closely with the House bill than the current Senate version at the federal level. So anyway, and then other great pieces of information to have at your fingertips are copies of proposed legislation, of course, state and federal, possibly letters of support from local influencers, especially business owners, issues or activist groups. And then of course, have handy contact information for members of the city council in your area. So in case you run into people who say, well, yeah, I think I like that, let me call so-and-so, my council member, just make it easy, you know, be a resource. This is a list of useful websites. I wanna highlight National Nurses United, which have really taken the lead on pushing for a national health plan, Medicare for All, and also Public Citizen, both of whom have developed resources and training programs for the City Council Resolutions Initiative as part of the strategy to win Medicare for All. And I wonder, Dave, I know you have been involved in doing some training with Public Citizen. Can you comment on that a little bit?
Sure. Last December, I think it was, I responded to an email that sent out to Judge interested, and I've been staying with them ever since then. They have a monthly meeting, and they also have the monthly meeting is a leadership meeting, so it's people that are doing this around the nation. So it's all over the place. A lot more going on out west than anyway, well, on the coasts especially, but a lot of stuff going on in California all the time. But it was really, it's interesting, and it's interesting to hear other people and how they're progressing and what their ideas are. And then also once a month, they have a webinar that you can attend, and they'll have a special topic that they talk about, or an expert that'll come in and answer some questions, and it's all really good. And what I'm going to do is put in the chat, let's see. I think I got them all. Yeah, I put in the chat under Public Citizen 3 different links to their resolutions website, 3 different pages on that website, and lots of good stuff there. So just check them out if you wish.
Thanks a lot, Dave. Several other websites I've got up there. Healthcare Now has been, and Public Citizen have teamed up to do national strategy conferences once a year. The One Payer States is also a sort of a consortium of all the states in the country, about 17, who are actively working on a state-based health plan. We all know that we want a national health plan, national improved and expanded Medicare for all, but state-based health plans can be a good step in building support for that eventual change. So next up, our upcoming events are, I'm going to populate this. Sorry about that, the way that slide works. First up, I just want to make some announcements. So you have a little bit of information about events we have coming up. And Jen, I wonder if you could comment first on the PNHP Minnesota annual picnic.
Absolutely. Everyone is welcome. I'm going to put in the chat a link to our RSVP form. Our event is going to be on Thursday, August 12th. It's going to be 5:30 to 8 p.m. at Como Park at the Midway Pavilion. It is a family-friendly event. It is just our first big in-person event that we're having in over a year. Everybody's welcome. We're going to have just light refreshments, sandwiches, some wine and beer. We're just going to sit and talk single payer, get to know each other again, reconnect. And then we will also have presentations by our interns that we hosted this summer. So we're looking forward to seeing everybody there. You are welcome to join us, bring a friend, bring a coworker, and yeah, we'll see you in August.
And when you get an invitation in your email, I gather you would like an RSVP if possible because you're planning refreshments.
Yes, we will be providing food and beverages. So if you can give us a heads up that you're coming, I did put the link in the chat now. So if you want to let us know now or later, we're happy to do that.
Okay, thanks a lot. And it is, I'll just say it for Jen, it's a little bit of a fundraiser as well. We all need funds to do this work. Next up, in the spirit of grassroots organizing, our first big in-person tabling event for at least those of us in the metro area is we are going to be tabling both Healthcare for All Minnesota and PNHP Minnesota at the 2021 Twin Cities Pride Festival, which is July 17th and 18th. We need lots of volunteers. So we're going to be, you'll be getting a request with a form to sign up to volunteer in your email. I think it actually went out today. This is a great opportunity to talk to a lot of people about something that is an important need in the LGBTQIA+ community. Members in the metro, like I said, should have gotten an email, or you can put in the chat if you're interested in volunteering as well. We're going to ask for 4-hour shifts on Saturday and Sunday, 10 a.m. to 2 or 2 to 6. This is in Loring Park in Minneapolis. Let's see. And
sorry, do you want to mention we will be doing just advocacy training prior to the event. So if you have questions about what that event will look like, where to park, how to talk to people, we will go through that the week before.
Yes, if you volunteer, lots more information will be coming. Yeah, we do have a volunteer training set for July 15th. If you can't make it, that doesn't mean you can't volunteer. We can easily just train you on the spot, and we're going to have materials ready for people to use to hand out. But of course, just encourage people. It's a great experience. We did do this 2 years ago, and it was fun and interesting, and we got a lot of contacts from that event. We're also planning some social media training to increase use of our social media sites. The first Lunch and Learn will be noon to 1 on August 4th. We have a tremendous social media team with it's Jessica, our new admin person, a graduate student, Carolyn, Jen Crawford from PNHP Minnesota, and a medical student who's specializing in this, an intern just for this summer. So I'm really looking forward to that. My demographic needs it, and it's a series of 3. The curriculum looks great. Again, so reminder to continue to write and respond to action alerts from either organization. See our calendar for other meetings. Please send us any events scheduled for your local groups that we would like to post on the calendar, or anything you need publicized. Also, we certainly can provide speakers for local events, I would say via video conference. Eventually, we may be able to move back to some in-person speaking, or even question and answer sessions, which people seem to like. Then I'm going to talk about a specific call to action tonight. And I'll just mention that our next Healthcare for All Minnesota quarterly meeting is September 11th, 9:30 a.m. We've been doing video conference meetings. We'll still have the video conference option available. We may do an in-person, still talking about that, but we'll have could be a combined availability of that meeting. And then I forgot to mention that we do have a sign-in for this evening, and the link for that is in the chat. It's probably at the top of the chat. If you would be willing to sign in for this evening, make sure that we have complete contact information for you. So then here's a couple of slides with contact information for me and for Don. And then hot topic. This is my last final pitch for this evening. Please take action to support the Medicare expansion proposal now. Proposals have been made to President Biden and Vice President Harris and Speaker Pelosi and Senate Majority Leader Schumer to expand and improve traditional Medicare now as part of the American Families Plan. And this would improve and expand Medicare in 3 important ways. It would lower the eligibility age to 60, improve benefits by adding hearing, dental, and vision benefits, and cap out-of-pocket costs, and allow Medicare to negotiate drug prices. This is strongly supported by our organization, by National Nurses United, by Physicians for a National Health Program, and numerous activist organizations. We want to be clear that this proposal is seen as an important step toward our goal of Medicare for all. This would strengthen our social insurance model. It would reduce or remove commercial insurance from our public health insurance program for seniors and the disabled. It would weaken and divide the opposition. It would bring in more allies. It would build the infrastructure we need for a national health plan. It would make the transition to Medicare for all easier, and it would be an historic win for the movement. So this is, we all know we want the whole thing, Medicare for all, but this would actually be an important and strategic step along the way. So we're asking tonight that you please call our senators and your own representative, your own member of Congress, either to thank them for supporting this proposal or urge him or her to support it. And that means members of Congress of either party. Members of Congress in Minnesota who are signed on to the letter to President and the President and the Vice President are Representative Betty McCollum, Representative Ilhan Omar, Representative Dean Phillips. Representative Angie Craig does not appear to have signed, at least as of April 26th. And Senator Tina Smith supports this proposal. Senator Amy Klobuchar at this time does not. So of course we need to be making calls and perhaps going to her website and contact her with something in writing as well. I've got the phone numbers up for you for that. You could get out your phone right now and take a picture of that slide. If you want to do that tonight or tomorrow. If you call tonight, you will be leaving a message. If you call tomorrow, you might actually get a staffer to talk to. So this is actually would be a huge win for this movement, and we really encourage that you make that call. We'd like to see this included in the American Families Plan as part of the second part of that infrastructure, the big infrastructure bill that they're working on in DC. Okay, so I'll close by saying, look for a follow-up meeting specifically for people who are working on getting city council resolutions passed in their local area, or who are interested in getting started to share experiences, problem solve, provide a little structure, just as we have already discussed. And also open to anyone who's interested and willing in pursuing this process in their own town or city or county. So Jen, anything for wrap up that you can think of?
No, we hope you enjoyed this presentation. As always, please feel free to let us know what other sort of workshops and learning sessions you would like us to host. And just to build on what Anne said, the urgency of contacting our legislators, we really need to do this within the next couple of weeks. We only have till the end of July to make sure our voices are heard that we do support the Medicare expansion proposal. So be sure to send an email and give a call for that. We will also, and I believe we will be sending out our slides to everyone in case there was information that you wanted to have on hand. If you didn't get to take a picture of it as it was flashing across your screen, we will send that out via email to you after the presentation has wrapped up. So thank you so much. I see we do have some hands up.
Raise hands. Okay.
So this is the end of our formal presentation. So we thank you for coming. If you'd like to hang on the line, we will chat a bit more. So thanks so much.
I don't know who was first, Ken or Dave.
I was just going to say that Ken had his hand up.
Oh, okay. Go ahead, Ken.
When we make these calls to our representative and senators, is there a specific bill that we should ask for? I think the thing I want to avoid is some sort of Medicare expansion that would put the administration of this expansion in the hands of corporate insurance companies. You know, we want the government to be administering this, not corporate insurance companies. So I want to be advocating for the right thing.
There isn't a bill number to my knowledge. It would be a piece of the American Families Plan. So it's a piece of that big rescue fund. What the effect, the policy experts who are asking us to support this actively are what would happen is, if we expanded Medicare and included all these benefits, it essentially crowds out the commercial insurance industry, and there is no need for Medicare Advantage. So of course they know that. So, you know, there would be lots of opposition, but that's why we need lots of people power to support. We would effectively eliminate the need for that additional commercial insurance, you know, to traditional Medicare. Make sense?
And how beautiful is it that we would have vision, dental, and hearing finally included in Medicare?
Yeah.
Mm-hmm.
It's my advantage.
Right.
And the point of course, negotiating the drug benefit, prescription drug prices is that it should have been done in the first place, but that would provide billions of dollars that could be used to pay for these additional benefits. Right. So it's a package deal. John Crossland, did you have a comment or question?
Yeah, I did, Anne. I just wanted to expand on your comment about possibly contacting the Hennepin County Board, because as you know, I've worked for Hennepin County Medical Center, and we do have a board member on our board who is also at Hennepin County Medical Center. And for some reason, it has been very difficult to get that institution to endorse Medicare for all. And I don't quite understand why. I have spoken up at several medical conferences, and I'm actually told to shut up. I'm not even allowed to speak about this. And there's something at the county level that is prohibiting them to endorse this. And I don't understand it. And I think that's an area that we really should work on. And I think we could go through the county board. I think that would be very helpful.
Okay, good insights. Thank you. Hillary.
I would like to respond to that, John. I have worked on Marion Green's campaigns, door knocked for her. I know her quite well. And I mean, not personally, but I know her fairly well. And she is totally behind Medicare for all. So in fact, she had told me that they were trying to self-insure at the county level. They were trying to push that. And so I was thinking, and I was going to get a hold of Dave because he has a Hennepin County person. I know a Hennepin County person, and I don't know if Ann knows a different one, but I thought we have really good contacts.
Okay, that's good to know.
I think Marion would be totally with us.
I think it'd be fantastic if we could get the county board to endorse us.
I think our team is growing. Thank you. I want to say our formal presentation is done, so you are welcome to stay, or everybody who's still on our call, welcome to stay on. We'll stay on, keep it open for a few minutes, or you won't miss anything if you want to go on with your evening. And thank you very much for attending.
Yeah, I just want to say that there's really, I'm kind of repeating myself in what has been said, but I think that there's really great potential from what was shared this evening and what was just said involving possibly Hillary and Dave and John regarding the county board. So I think it behooves us to continue to meet. This could really grow into a big project.
So what is your plan for that? Were you going to contact everybody to see what date would be good or what time would be good and so forth?
Yeah, we're going to have a follow-up. I don't know, how soon do you think we should have a follow-up?
In 2 weeks.
Okay.
Okay.
You know, we usually meet like for the Southern chapter, Southern Minneapolis chapter. We usually meet on the second Thursday. If we met as a group, maybe on the fourth Thursday. I mean, I don't know if that conflicts with other people, but that would give us like a 2-week slot.
Okay, yeah.
I probably won't be available till mid-August, like maybe the second week of August.
Okay. And our second Thursday in August is actually going to be the PNHP Minnesota picnic. We want people to be available to attend that. So yeah, Hillary, your comment is we'll pick another one. And big Indivisible group meets on the third Thursday. So you're right, the end of the month might work out. We can send out a poll for what is a good time too, and set it, later on. Details, right?
I do recommend having an established day though.
Oh, okay. That's what your comment is. Okay. All right.
So you're suggesting the fourth Thursday of the month, Hillary?
Okay. All right. Any other discussion?